One of our most popular procedures is liposuction. Liposuction is body shaping, it's body contouring. It's using liposuction devices, which we have several of to help us with it, but it's used to shape trouble areas of the body.
Okay.
Probably most common is abdomen and waist. We also can do liposuction of arms, love handles, inner and outer thighs, underneath your chin. We can do liposuction of anywhere just about that there's a trouble area of fat. So with liposuction here, one, we use either VASER, V-A-S-E-R, ultrasound assisted liposuction, or we use smart lipo, which is laser. And after we melt or liquefy the fat, then we suck it out with metal cannulas, which are like metal straws. That entails, it's an office-based procedure. We either do oral sedation or IV sedation, or occasionally if it's a small area, we can just numb it up. And after the patient is sedated, or we anesthetize or numb the area with a liquid solution that makes it comfortable, we then liquefy the fat and then melt it. Those procedures, depending on the area, can take anywhere from 1 to 2 hours up to 3 or 4 hours, depending on how much shaping and areas we're treating. They'll notice an immediate difference. However, patients can swell or bruise, and I always kind of joke around and tell people for the first week you're not happy, and because you're maybe bruised or swelling and it's uncomfortable. After that week it gets much better, but during the first week you take oral pain medicines and some nausea medicine if you need it, and I always give prophylactic antibiotics and maybe a little anxiety medicine to kind of help keep you calm or help you sleep. It's important during the first several weeks of recovery from liposuction that you follow the instructions of wearing your compression garment, kind of keep everything, minimize the swelling and bruising, kind of help hold the area smooth, and then we quickly kind of convert you to maybe a Spanx or another type of more comfortable compression garment, maybe even like Under Armour or something like that. The results get better. I tell people if they're looking to get better for bathing suit season or a wedding or something like that, you want to do it at least 3 or 4 weeks in advance so you can have the optimal amount of time to kind of get to showing it off a little bit. But the thing about liposuction is it gets better and better. It looks better at 3 months than it does at 1 month. It looks better at 6 months than it does at 3 months. And then it just continues to kind of improve. Patients always ask if they gain weight, can I gain it back in that area? And you certainly can. We don't take all the fat out, and so you still have to eat right and maintain a body weight. If you gain weight, typically it might go somewhere else a little more, maybe a little bit disproportionate because there's less fat cells in that area. But also conversely, say you eat right and you lose a little bit of weight, I always encourage patients not to be at their rock bottom weight, but if they lose, say, 5 pounds afterwards, they kind of shrink wrap, they'll tighten up other areas because the fat's already gone from that area. So liposuction, we always hide the scars in inconspicuous places, but also the scars are typically less than 1/4 inch wide, and they take 1 stitch to close, and they heal, honestly looking like nothing. If there's ever a scar that doesn't look quite right, I can numb it up, and I would want to make it look right, or we can use a laser to kind of treat unsatisfactory scar, or just to try to minimize it even a little bit more. And so I always offer that to all my patients. And ideal candidates for liposuction are basically anybody with a trouble area. It can be a younger, thin person that maybe has just a particular area in maybe their thighs or belly or whatever, and no matter how much they work out, they're having trouble losing that area. They're an ideal candidate to kind of have that area polished or shaped and kind of get the look that they're looking for or that they desire or want. But patients can go up to larger patients that maybe they just have trouble fitting in their pants or sitting in an airplane seat or something like that. And these are patients that I've had. And it's just to shape an area and help reduce the volume of an area so that they feel more comfortable in those situations, in their own clothes or in a seat or at a movie theater or things like that. And it's just to shape those areas. Specifically in guys, a lot of times they have kind of fatty breast tissue, and that bothers men. So a lot of times we'll do VASER liposuction of men's chest to help reduce their chest. It could be a patient that's already had significant weight loss, but they have some trouble areas. So maybe someone's had lat band or gastric sleeve and they've lost a lot of weight, but they still have trouble areas underneath their arms or chin or any area that they have a trouble area. And those are kind of the ideal candidates for liposuction.